Today, let us learn about fetal skull. Fetal skull is made up of thin bone which forms the vault. It has five areas. First, base. Base is the lower part of the fetal skull. Next, second one is face. Face, it extends from floor of the mouth to the glabella. Next one, third one is the sinciput. Sinciput, it extends from the glabella to the anterior fontanella. Then the fourth area is the vertex. Vertex, it extends from the anterior fontanel to the posterior fontanel. Then the fifth area is the occiput. It extends from the posterior fontanel to the nape of the neck. Fetal skull is made up of 7 bones. 2 frontal bone, 2 temporal bones, 2 parietal bones, one occipital bone. Now let us learn the sutures of fetal skull. First of all, let us understand what is suture. Sutures are cranial joints and are formed where 2 bones adjoin. There are 5 sutures in fetal skull. Frontal suture, which adjoin between 2 frontal bones. Coronal suture, which adjoin the frontal bone and the parietal bone. Sagittal suture, which adjoin the parietal bones. Lambdoidal suture, which adjoin the occipital bone and the parietal bone. Now we shall learn the fontanelles in fetal skull. The fontanelles are soft, flexible area on a baby skull where the bones have not yet joined together. There are 2 fontanelles, anterior fontanelle, posterior fontanelle. Now we will look at anterior fontanelle. The anterior fontanelle is formed anteriorly by frontal sutures, laterally by coronal sutures, posteriorly by sagittal suture. It is diamond in shape. It measures around 3 to 3.5 cm in all sides. The other name for anterior fontanelle is bregma, and it closes when the baby reaches 1.5 years. Now we will learn about the posterior fontanelle. Posterior fontanelle, it is formed anteriorly by sagittal sutures, laterally by lambdoidal sutures. It is triangular in shape. It measures around 1 to 1.5 cm all sides. The other name for posterior fontanelle is lambda. It closes when the baby reaches 1.5 months. Now we shall learn about the diameters of fetal skull. Anterior posterior diameter. Now we shall learn about the posterior diameter. There are 3 diameters posteriorly. The first diameter is called suboccipitophragmatic. It extends from nape of the neck to the center of bregma. It measures 9.5 cm. Second diameter is called suboccipitofrontal. It extends from the nape of the neck to the anterior end of anterior fontanelle. It measures 10 cm. The third diameter is called occipitofrontal. It extends from the occipital eminence to the center of glabella. It measures 11.5 centimeter. Now we shall learn the anterior diameter. Anteriorly, there are three diameters. The first diameter is called mendovertical. It extends from the floor of the mouth to the highest point of the sagittal suture or the vertex. It measures 14 centimeter. The second diameter is called submendovertical. It extends from the floor of at the junction of the mouth to the highest point of the vertex or the sagittal suture. It measures 11.5 centimeter. Third diameter is called submendobrachmatic. It extends from the floor of the mouth to the center of brachma. It measures 9.5 centimeter. Now we shall see the transverse diameter. Transverse diameter, the first diameter is called biparietal diameter. It is between two parietal bones. It measures around 9.5 centimeter. Second diameter is called supra-subparietal diameter. Supra-subparietal diameters are measured one side below the eminence of parietal eminence, the opposite side above the eminence of parietal eminence. It measures 8.5 centimeter. Third diameter is called bitemporal diameter. It measures between two temporal bones. It measures around 8 centimeter. The fourth diameter is called bimastoid diameter. It is between two mastoid bones. It measures around 7.5 centimeter.